Living with diabetes can be a lot of work. All those finger sticks and injections, trying to remember the tricky carb counting, and of course, the constant worrying can make it seem like a 24/7 job. Or you can let the MiniMed 780G system do most of the work for you. The MiniMed 780G is the only system with meal detection technology that automatically adjusts and corrects sugar levels every 5 minutes, giving you more insulin when you're trending high, less insulin when you're trending low, every 5 minutes. So even if you undercount your carbs or occasionally miss a meal dose, the system can automatically help correct for it, providing real-time insulin adjustments and corrections all day and night. And put your worries to rest. The MiniMed 780G system, designed for real life.
Welcome everyone, and thank you so much for joining our third live stream now. It is hard to believe, but it's already been 5 weeks since we received FDA approval for our MiniMed 780G system. We've had so much fun sharing the ins and outs of this incredible system and are equally as thrilled to be able to talk to you all a little bit more about it today. Let's move on to the next slide. So my name is Paula Mora, and I'm a clinical specialist with Medtronic Diabetes. I'm a registered dietitian and a diabetes educator, and I've been with the company a little bit over 8 years. So on a personal level, I am particularly tickled and honored to be a part of these webinars, to be a part of this launch. I mean, we've all been looking forward to this for a pretty long time, right? And well, for me as a clinician and as a pump trainer, this means a lot because of all of you. And that's because our North Star at Medtronic, as you can see here, really is to help reduce the burden of living with diabetes through a better experience and ultimately, of course, better therapy. And that is what the MiniMed 780G system brings. It is designed for real life. And you're going to see that a lot throughout today's presentation and in future announcements about the MiniMed 780G system. So let's take a closer look at the system on the next slide. There we go. Ooh, let's go back one. That's perfect. There we go. You got it. So the MiniMed 780G system. So it's the only system with meal detection technology that provides automatic adjustments and corrections to sugar levels every 5 minutes, which in simple terms means the advanced technology in the system can take on more of the work for you to help make managing diabetes easier. That's the goal, right? But this also means that there's finally less pressure around meal times, which I keep saying, yay, too. Now, we know how essential convenience is to all of those of you who use technology or are considering using technology. And that's really where the extended infusion set and reservoir, of course, the MiniMed mobile app and the Guardian 4 sensor all come into the picture. So with the Medtronic extended infusion set and reservoir, you're able to use your infusion set for up to 7 days, which means 96% fewer injections as compared to multiple daily injections. Major win. And then with the MiniMed mobile app, you're able to see both CGM and insulin data on your mobile phone and now Apple Watch, which is amazing. And you're able to share that data with those that you know and love, which is super important, as we all know. And then finally, with the Guardian 4 sensor, there are less alerts and alarms, plus no finger sticks needed in SmartGuard technology. And guess what? Our pivotal trial data actually shows that most MiniMed 780G system users spent 95% of the time in SmartGuard technology. Neat, right? Let's move on to the next slide. This is where I want to just talk about what we're going to get through today. So first, we've got a treat, a really big one. Dr. Jennifer McBean is going to kick things off by walking us through how the MiniMed 780G system works, as well as how kids are doing on the system. Corey Eck will share his personal experience on the MiniMed 780G system. And that's going to be before Heather Lackey gives us a preview of what the system looks like after the software upgrade. We'll then spend the bulk of today's time on the most important piece, which is, of course, your questions, right? Which reminds me, you can ask questions at any time in the Q&A feature next to the video player, which should be, I think, on my right or on my left, but it's here. We've also been paying close attention to our social channels and have been gathering questions already, some frequently asked questions. So we're going to share those during the Q&A section of our program a little bit later today. So stay tuned for those. Next slide, please. Okay, so with that, I now have the privilege of introducing you all to our Senior Medical Affairs Director, a wonderful leader, a compassionate clinician with deep commitment to and experience in serving the diabetes community. That's Dr. Jennifer McVean. Dr. McVean, are you out there?
I am. Thank you, Paula. Good afternoon, good evening, and welcome. Buenas tardes, buenas noches, y bienvenidos. It really is such a pleasure to be here with all of you. As Paula mentioned, my name is Dr. Jen McVean. I'm a pediatric endocrinologist, and I joined Medtronic a little over a year ago as a medical director. My passion has always been taking care of children and families living with type 1 diabetes, and my research has involved starting automated insulin delivery shortly after the diagnosis of type 1 diabetes. And just like many of you on this call, I also live with type 1 diabetes, and I've lived with type 1 diabetes for 35 years. Next slide. So I want to take a minute to really kind of go through how the MiniMed 780G system works. And I'm going to ask you, Edie, who is helping us with the slides, to kind of advance through them, and then I'll kind of speak as we go, so you have all the information on the slide. So the first thing that I want to talk about are the targets with the MiniMed 780G system. The targets are 100, 110, and 120 milligrams per deciliter. These are something that you and your healthcare provider set when you start the MiniMed 780G system. The next thing I would like to discuss, which is really revolutionary for the MiniMed 780G, are the auto corrections. Auto corrections can occur as frequently as every 5 minutes. And these are really helpful for times when perhaps you've underestimated your carbs or even sometimes forgotten to bolus. When you look at the graph here, you see the pink lines, and that's the auto basal. So this person has a target of 100 milligrams per deciliter, and you see the dashed line there. So as that glucose starts to climb, the amount of auto basal, the pink, that increases. Now, if the glucose gets to be over 120 and the maximum amount of auto basal is reached, then those auto corrections kick in, and those are the darker blue lines. And so what you see is, with the help of those auto corrections, the glucose comes back down more quickly into range. And it's a continuum every 5 minutes, around the clock, 288 times a day, whether you're awake or asleep. The system is making a decision on how much insulin to deliver. Next slide. Now, I want to talk a little bit about meal detection technology, because this is something that is new to the 780G and is quite revolutionary. And it builds on our ability to autocorrect. Every 5 minutes, the system is taking a look at what is the current glucose and what has the trend of the glucoses been, and also how much insulin is in the system. And it's using that information to make a decision on how much insulin to give. So in this example, you see that the pink lines, again, are the auto basal, and they're keeping that patient somewhere around the target of 100. Then you see that sharp rise in glucose. This occurs if someone has forgotten to bolus or if they underestimated carbs. Now, when that sharp increase in glucose occurs, the system allows a bigger autocorrection than usual. When you see the dark blue lines there, those would be the typical autocorrections, but with that sharper rise in glucose indicating a meal has been consumed, the light blue, the extra amount, is able to be given. And what we see with that is that the glucose comes down back into range more quickly. Next slide. I want to show you an example of one of our participants from our pivotal trial. Anytime that a device company has a new device, prior to getting that approved by the FDA, we needed to do a clinical trial. And we did a clinical trial in the US for the 780G. And one of the things that the FDA required us to do during the clinical trial was to see what happens if patients forget to bolus. So here's an example. This is a 12-year-old participant in the study who ate 45 grams of carbs. You can see that her target was 100 milligrams per deciliter and her active insulin time was 2 hours. Now, when you look down below on the left, we see what actually happened. So she ate, she didn't bolus, and the green is the autobasal. And then as that glucose started to rise, the black kicked in, and that's the autocorrections. And she received 17 autocorrections. And by about 2.5 hours, she was down to about 150. And by 3 hours, she was back down pretty close to her target of 100 milligrams per deciliter. Now, we are encouraging all patients to, of course, bolus before they eat. However, those of us living with diabetes know that sometimes we underestimate carbs or sometimes we forget boluses, and that's where the meal detection technology can really help. Next slide. Now, I want to show you a little bit of information, and I know that's a busy slide, but I'll kind of walk you through it. So we have had the fortune of having the MiniMed 780G system in Europe for almost 3 years. And because of that, we have a lot of information. So the first thing I want you to do is to look at the column over on the left under overall. So we see this is about 13,000 users. And when we look down below, we can see that their overall time in range was 75.8%. Now, what I want us to do next is to take a look at those who are over 15 and those who are under 15. When we look at those who are over 15, we see the overall time in range of 76.5%. And then we see the time in range for those who are using a target of 100 milligrams per deciliter and an active insulin time of 2 hours. These patients had a time in range of 81.3%. So we are recommending, as we launch the MiniMed 780G system in the US, the recommended settings for kind of the average patient with a target of 100 and an active insulin time of 2 hours. These are, of course, settings that you'll discuss with your healthcare team. And you may be in a specific situation where different settings are needed, and that's fine as well. But these are the overall settings that we're recommending. Now, when we look at those under 15 years of age, we can see the overall time in range of 73.9%. And then when we look to the far right, we see those with the target of 100 and the active insulin time of 2 hours also had the highest time in range for children of 78.9%. Now, one of the things as a pediatric endocrinologist that's really important for us to look at, in addition to time in range, is time below range. We know that the recommendation for time below range is to be under 4%. And so when we look at the 100 milligram per deciliter target and 2 hour active insulin time, the time below range is under 4%. However, we do see that it's a little bit higher than in that middle column if we use the target of 110 milligrams per deciliter and an active insulin time of 2 hours. So what our recommendation is for those under 15, again, working with your healthcare team, starting with the target of 110 and an active insulin time of 2 hours. And then if there are no concerns with lows, moving to that target of 100 and active insulin time of 2 hours. Next slide. The other thing that I want to discuss briefly was the sustainability of using the MiniMed 780G system. Here we see over 2,000 users from Europe, and these are all children under 15 years of age. One thing I want to highlight in the chart is the line right below users where it says time in AHCL or SmartGuard. And you can see that the patients are spending 95% of the time in SmartGuard. And we're really excited that the patients are spending that time in SmartGuard, and they want to be in SmartGuard because their outcomes are better. Now we look below and we can see consistent time in range above 70%, as well as consistent time below range of under 4%. Next slide. And I want to finish by bringing it back to us, to the patients. I want to share a story as an investigator of a study called Clever, where we started automated insulin delivery within a month of diagnosis, including the 780G, in over 100 children ages 7 to 17 in the US. And one of my study participants was a lovely young man who was 15 years of age. And he was randomized to starting the 780G 3 weeks after he was diagnosed. And a few months later, he came into the office for one of his research visits, and we were looking at his downloads, and his time in range was great. It was awesome, in fact, but something that he said to me was really even more impactful. He looked at me and he said, "Sometimes I forget I have diabetes." And really at Medtronic Diabetes, that is what we are trying to do. We are trying to help patients forget for a little while that they have diabetes. Now, I have the great pleasure of introducing Corey Eck, who has lived with type 1 diabetes for 20 years and who has also been on the MiniMed 780G system for the last week. So Corey, we would love to hear all about you and type 1 diabetes and your experience.
Yeah, I don't know about you, Dr. McVean, but I've been doing my happy dance over here all week. Just being on this new system and the experience I've had has been, honestly, at this point, it's been so relieving. Not having to think about my diabetes as much, it has been exactly what I've been looking for. And the only reason I know it's a week is that I changed my sensor today. And guess what? I did not exit from SmartGuard. For me this week, I've had 0 exits and my pump is not beeping at me or telling me things to do. And I can actually get to doing what I want to do as part of my life. When I think back, you said I've had diabetes now for the last 20 years. And since that time of diagnosis, it's been on the forefront of my mind. And, it's not anything that we can take breaks from or put away or, forget about for a length of time. The first step towards that, started on March 18th of 2017 for me when I started MiniMed 670G. In between meals, I was able to think less about my diabetes. But it wasn't until just this past week getting on 780G, I didn't really think much about how much it was going into how I managed my meal times or how I was thinking about my pump overnight. And just being able to, I don't want to say set it and forget it, but just really being able to do what I need to at a mealtime and get the pump back in my pocket as quickly as possible has really helped me to open up and really focus on the time that I have that I really want to spend time on. And for me, that's focusing on my daughters, it's focusing on work, it's focusing on my life at home and being able to do those activities. I mean, we all just had Memorial Day weekend. I'm sure many of you were at a pool or out on the lake or having fun with your family. It was really nice to be able to do what I needed to for a very short amount of time and get that pump back in my pocket. For me, the exciting piece too is just, again, these less alerts and less alarms because of some of the changes that are coming with 780. There's a lot more freedom with the way that this system is taking action for us as patients. And it's really given me the opportunity to again, focus on what matters most. And, just like all of you, I mean, I wish I was a perfect diabetes educator and I knew how to count carbs and, was on top of all that stuff, but, life gets busy. I forget sometimes too, but I was completely blown away when I woke up the one morning. And it was then that I realized I forgot to bolus for dinner the night before. I don't think any of that has ever happened before in my life where I could put diabetes in my pocket for, 12, 13 hours and not have to interact with my pump. I was trending down going into dinner, didn't want to bolus right away. I was afraid to go low. So, I ate the lasagna that I was having that evening and just completely forgot to bolus. And, spending time above range would have been the norm before. Having to go in and correct or having to pump wake both myself and my wife up overnight would have been a normal occurrence. But none of that happened. It was, when I woke up that morning and I was just completely bought into this system at that moment, knowing that it was there to protect me. And overnight, it gave me 21 auto corrections. I can't think about how much insulin was needed for that food. And not to mention, we all know lasagna is not the easiest food to carb count, or when you think about the extra fats and proteins that come along with a meal like that, it can be a challenge. And so I no longer have to worry as much about that. For me, it's about, hey, how close can I get? I'm not going to fret over all the little carbohydrates in this food or when something's going to absorb or not. I'm just going to get close, get in the ballpark, give myself some insulin for that meal, and I'm going to let the pump take care of the rest. So it's this freedom, it's this lack of the mental burden, it's the meal times that are becoming so much easier now. And for many of us, that's multiple times a day. That's breakfast, lunch, dinner, that's potentially snacks in between. To not have to think about diabetes on all of those occasions has really been relieving for me. And so I'm just excited for each of you to have this experience, to start getting this in your hands. Again, whether it's the pump or whether it's the sensor, there's so many enhancements with this system that are going to help me live my life. And that's the best part about this is I know some of you are probably want the Apple Watch. I'm not going to be someone that wears it. I want to be able to forget about my diabetes, like I mentioned. And so, with all these great enhancements, we get to choose what we want to use, how it's going to impact us, but all of it's going to help us think less about our diabetes and get better results moving forward. So, you see some of my results here on the screen. I can't wait to hear about the many more stories of you that are going to get on this system over the coming weeks and months. And so looking forward to seeing what that looks like for each one of you. So I know I'll be sticking around. Feel free to ask questions later. More than happy to share any experiences I've had so far over this wonderful first week on MiniMed 780G. So I believe I'll be passing it off there to Heather.
Wow, Corey, that is truly amazing. So cool to hear, just the impact that this system's made on you and your family, and just on your life. So that was amazing. I thought it might be kind of neat for everyone to be able to see how this system actually works, right? To see it in action. We're hearing about it, but what does the pump look like? And I always tell everyone, man, you cannot judge a book by its cover, right? I tell that to my kids about as they're making decisions in life, but really with this pump, I would say you really want to experience it, get to see it, look at it. The sensor's different, the pump is different, and I think you're all going to be really pleased whenever you have a chance to wear it yourself. But let me give you a sneak peek, kind of an under the hood look at everything. So what I really want to do is I'm going to take you to the next slide, and I'm going to give you the opportunity to get familiar with the MiniMed 780G system. All right. So if you have your phone, go ahead and take your smart device or your phone and go to the QR code and pull this system up. And what you're going to be experiencing along with me is the virtual pump. So we'll leave this QR code on just for a few minutes more. If you're grabbing your phone, no worries. And of course, we'll be able to provide this link to you even later on if you're just not equipped to go through the pump with me right now. It's on our medtronicdiabetes.com website too. But I think I'll go ahead and I'm going to show you this virtual pump right now. So we'll go ahead and kind of switch over, and we'll just go, and there we go. We're refreshing everything as we speak. So I'm going to, on my computer screen here, I'm going to go ahead and I'm going to remove the keyboard icon. Since I'm not going to be working the keyboard, I'm going to kind of try to work alongside of you. Let me decrease this just a little bit in size. All right, let's see here. Okay, so everyone can see the pump on the screen. Is that correct? All right, great. So first thing that we need to do is select what language that we want this pump to, talk to us in. And so today I'm going to select English. Of course, you can use simplified Chinese or Spanish in the US, but we're going to select the English option. So you just press the select button. Now, before I even move forward, what did you notice if you have been on a MiniMed 670G or MiniMed 770G pump? What did you just notice that you did not have to press? There was no challenge screen, right? You didn't have to unlock the pump. You didn't have to do anything. It just goes, right? And so that's something really, I think that Medtronic did a pretty fantastic job listening to our, us as people with type 1 diabetes and our patients. we really wanted to remove that challenge screen, and so that's gone. Now, for those moms and dads who have little ones or anyone that is concerned about a button getting pressed and, giving insulin accidentally, there is still a kind of a lockout feature. So that's still available to you, but for the rest of the people, you don't have to worry about that. Let's go ahead and just go through the startup. This takes 2 seconds. I'm going to choose 12-hour time, AM and PM, and I'm just pressing the select button. So right now it is, it's about 5:30. I'm in Central Time. And so it's, let's go. I'm just pressing the up and down arrows, right, to move the cursor around. So it's 5:26, whatever. We'll make it 5:26. And then I want to change the AM to PM, right? We always want to make sure that that time is set right, since insulin delivery is depending upon it. So the year's already set. Our month, we need to change from January. We'll select it to make it blink, and then we'll go up to June. And then it's already June 1st. That's today. And so we'll press next. Now, the only thing that has to happen here is the piston kind of rewinds, right? So this is a virtual pump, and it is trying to give you the experience of what like a fully functional pump would be. Clearly, there's no alerts and alarms and things like that with this system, but there's really not many alerts and alarms with the handheld MiniMed 780G system either. So kind of works out. So we'll just press OK on the congratulations. When it says, hey, the startup is complete, we'll press OK. And now this is your home screen whenever you don't have CGM connected to your system. So if you had entered a BG, the BG would be listed there for like 12 minutes, right? The BG stays on the screen for up to 12 minutes. But the rest of it is just kind of, your active insulin, you've got your time and things like that. So let me show you the cool parts now, right? You're familiar. Those of you that have worn a pump, whatever pump that is, you know how to use the up, down, left, right arrows. You've got your back button. And so if we press the select button from here, you're going to see what we call the 3x3 icon screen. So there are 9 icons, 3 on the top, 3 in the center, 3 on the bottom, 9 icons total, where you're going to find information about this pump and what people have loved who have been wearing MiniMed 780G system. They love being able to find the information so much faster. They just go to the icon. Everything that deals with insulin, right, and your insulin delivery is there on the icon. So you just select the insulin icon, and if you want to bolus, fine, you can bolus from there. If you want to change your basal rate, you can change your basal rate. If you want to go into delivery settings, it's all there, right? So we can go and set up the bolus wizard. We could go, put your carb ratio in and your active insulin time. And remember, what was that recommended active insulin time? That's right, 2 hours. That is the active insulin time that the data shows that we have fewer lows, we have fewer highs whenever that active insulin time is used. Okay. So you will be able to go and play with all of this and kind of practice, set it up, get comfortable with everything. Clearly, this is not your pump training. This is just a peek under the hood. But now I want to show you something just totally cool, right? So I am going to press this. So it almost looks like a down arrow, kind of a pointing arrow pointing down towards the ground. If I press that on my computer, I see these what are called skip ahead icons. We're skipping ahead to a different mode. And for you, if you've got your cell phone and you're following along with me, on the bottom of your cell phone, you're going to see this kind of right arrow or arrow that's kind of pointing to the right-hand side of the screen by a question mark. Press that right arrow and you'll still see these same skip ahead icons. So if I wanted to just have, and this is just for practicing and seeing what the pump can do. If I wanted to have continuous glucose monitor and I want to see what my screen looks like with the continuous glucose monitor, I'm going to press the skip ahead icon that has the pump and the transmitter. And I press it and voila, I have CGM data on my screen. Now, everyone, I probably don't have to say in real life, that does not happen. You will have to pair your sensor to your pump, and you'll have to, get everything going like you always do with any systems. But for the virtual world, we can use these skip ahead icons. So here is what I want to show you, how cool this is when we have continuous glucose sensing. If we press the center button, and we're now in that kind of main menu, those icon menus, we can go up to the SmartGuard, right? We always want to look for that shield, that SmartGuard shield, and we can select that. And then there's a checklist that tells us what needs to, be turned on, or what needs to occur on the pump to get into SmartGuard. You can go into SmartGuard settings, but let me tell you, the target is going to be defaulted at 100. And the auto corrections, are defaulted to be turned on, because that's what gives us the best level of control, right? So if we needed to change a target or turn off the auto corrections, we could do that here. But my goodness, for the majority of the patients that are listening, and people with diabetes, you families that are out there listening, that default setting is already there. You don't have to change anything. Now, the last thing I'm going to do is I'm going to go into SmartGuard, and I'm just going to select it, and I'm going to turn it on. So this is what you're going to see after you go through your software update. You're going to have continuous glucose sensing on your, displaying on your screen. And after those, remember, you've got about 5 hours that you'll be in the manual mode feature. And after 5 hours, after your update is completed, the system is going to ask you for a BG. And so you'll get your glucose meter, and you will go ahead and, tell the pump that you are reading, and you're responding to the request to enter a BG. So I'm going to show you a fun, cool way to enter a BG. You can just press the down arrow whenever you're at the home screen. And here we go. We see the BG. We can just say, I checked my glucose with my meter. Obviously, I'm entering in a pretend glucose. Let's say right now my glucose is 102. And I can press save. And I'm not going to deliver a bolus or anything like that, but I can just enter a BG by pressing one down arrow. I could enter grams of carbohydrate if I wanted by pressing one down arrow. It's so easy to use. And then look at this, magically, we are in the SmartGuard mode. So that's all that is needed in order to pop right into SmartGuard. So I really hope you guys have a lot of fun playing and exploring with this new MiniMed 780G system. And I think you're going to be better equipped for the training that you're going to receive whenever you all go through and go through the software update process. So I think I'll go ahead and pause and turn it back over to Paula.
Thank you, Heather. That was fantastic, fantastic demo. We are hearing that a lot of people, not surprisingly, are interested in accessing the virtual pump. So they're asking for that QR code again. We're going to get that to you so that you can access the virtual pump. Absolutely. So hang tight. We're going to get that for you. All right. But then thanks again, Heather. That was wonderful. I know everyone likes the virtual pump, clearly, patients and educators and everyone included. So we so appreciate you walking us through that. Okay. Oh, there we go. That's what we'll do. So if you want to just grab the virtual pump, here's that QR code again. So feel free to grab the next couple of seconds to scan that QR code and access the virtual pump. Heather, give me a nod. Isn't it true that if they Google the virtual pump, they can access it now as well?
You can. That's
okay.
Right. It's on the website. It's out. Yes.
Cool. There you go. So go ahead and scan the QR code. If you don't catch it in time, do not worry. You can find it on our website, and you can also Google it, and you'll be able to find it that way as well. All right. There we go. So let's move on to the next slide, please, when we're ready. maybe what I'll do. Okay, there we go. That's great. So before we move on to Q&A, which is the other favorite part of these sessions, I want to just take a quick little moment to really thank you all for allowing us to be your partner in your diabetes care. What's on this slide is really just a few of the ways in which we do that, whether it's through personalized onboarding support via both local or virtual options, via 24/7 technical support for things such as product replacements or even continuation of therapy pumps, for easy one-stop shop supply ordering through diabetes.shop, which also includes our online education, or through our access programs or ambassador programs. We are so proud that you allow us to always be by your side. So thank you so much for that. Let's move on to the next slide, which finally is our Q&A. So I know we've shared a lot of really great information today. I want to thank our panelists for being here. I'll probably say that a couple more times. That has all been phenomenal, but we are ready to tackle some of the Q&A that you have all sent our way. I did notice that some questions have been coming in during the presentation, so thank you all for those. As a reminder, we're using Slido to capture your comments and your questions. So to participate, just drop your questions in the Q&A feature that's next to the video player, one of these sides. If you also see that someone has already asked a similar question, you can just vote that question up so that it pops up a little sooner for us. Regardless, we're going to get to all of your questions, if not live right now, certainly after today's session, and then we'll subsequently share those with you. So do not fret, we will get to them. But before we get to those, I promised this earlier, I get to once again channel my inner David Letterman and walk us through the top 12 questions that we've received to date. So let's go on to the next slide. The first question is, how do I order the MiniMed 780G system? And you can place your order by going to diabetes.shop. We are going to begin working with your healthcare provider to get a new prescription once you do that, and shipping begins this month. And we're so excited for that. The next question is, what is the difference between the MiniMed 780G system and the MiniMed 770G system? So remember, the MiniMed 780G system is the only system with that meal detection technology that provides those automatic corrections and adjustments to sugar levels every 5 minutes. The MiniMed 780G system also pairs, or I should say the pump, pairs with the Guardian 4 sensor, which means no finger sticks in SmartGuard technology. And then the system also allows you and your healthcare provider to choose between the 100, 110, and 120 milligram per deciliter target. And then the third question on this slide is, if I have a MiniMed 770G pump, will I be getting a new pump or a software upgrade only? So all MiniMed 770G pumps are eligible for that software upgrade, and they do not require a new insulin pump. So that's great news. And then just keep in mind, all MiniMed 770G pump users, regardless of your warranty, you have access to that no-cost software upgrade. So the MiniMed 780G pump until April 27th of 2024. Again, as a reminder, we do need a new prescription that is required. And then for any and all other Medtronic pump customers, you can go on to diabetes.shop to check your upgrade options. So diabetes.shop, that's where you got to go if you want to find out anything else about your options. So head on over there as soon as you can. All right, next slide, please. So what happens if I don't have a compatible phone? So this does come up quite a bit, and that is totally okay. We of course know that there are so many phones, there are so many options out there, and not everyone is a perfect match. So we've actually developed what's called our phone loaner program. So once we can confirm that your phone isn't compatible and that you can't borrow one from a friend or a family member, we're going to go ahead and ask that you enroll. And we're going to send you a phone to use for that download. And you will send that phone back to us once you're done with that download process. So we do have a system in place in order to help meet the need for anybody who has a phone that is not compatible. So do not fret. Now, the next question is, I have several Guardian Sensor 3 sensors. Will I be able to use them or exchange them? And the answer, there's two questions here, and both answers are yes. So the MiniMed 780G is approved for use with both the Guardian Sensor 3 and the Guardian 4 sensor. So we will be replacing any Guardian 3 sensors that you have, 2 boxes actually, if they were purchased within the last 90 days, so that you can experience MiniMed 780G with Guardian 4 sensor. But just know that if you have Guardian Sensor 3 sensors, you can continue to use the Guardian Sensor 3 with your MiniMed 780G system. However, since we have this program where we can replace those 2 boxes of Guardian Sensor 3s, you should totally move on to Guardian 4 sensor so you can experience that whole system. We will take care of assisting you with that process as we complete your upgrade, so just lean on us. We're here. All right, so next question. Is the MiniMed 780G system available through Medicare? So the MiniMed 780G system has been submitted to PDAC, which is the group that generates billing codes for Medicare. So we do anticipate that approval on their end to come our way in July. And then we'll be able to support that upgrade process for our Medicare customers. So stay tuned for that. That is a hot topic question. All right. So the next question is, actually, I think we're going to the next slide. Yes, please. All right. So can I use the Guardian Sensor 3 with the Guardian 4 transmitter? No. So, and I want to say no, and I want to say no because of safety, because that is really the most important takeaway that I want you to take from this question's answer. So the Guardian Sensor 3 should not be used with the Guardian 4 transmitter. Those two are not approved to be used together, and the safety of using those together has not been tested. So the Guardian 4 sensor is only indicated for use with that Guardian 4 transmitter. Okay. Then the next question is, how much does the system cost? So keep in mind, Medtronic pumps are covered by most insurance plans. Your out-of-pocket cost, however, is going to vary depending on your insurance. So if you want to receive an insurance coverage check, call us. So this number is the number to call. It's 888-350-5440 between Monday through Friday between 9 a.m. and 6 p.m. Central Time. We do also offer financial assistance and monthly payment programs as well. And then we, of course, want all of our customers to experience the full MiniMed 780G system benefits. So for all of those within warranty Guardian Link 3 transmitters, we're going to be exchanging those for Guardian 4 transmitters at no cost. And then the next question is, it sounds like there are improvements to the number of alerts and alarms. Is this true? Yes, it is. So with the MiniMed 780G system, there are less alerts, less alarms than previous models, as you heard from Corey, less exits. And there are, so alarms do not cause exits. Some alerts still can, but there are certainly less exits, as we saw also in the US pivotal trial. 95% of the time, customers are staying in a range. So you will also have the ability to silence sensor alerts for high alerts, high and low alerts, and or I should say all sensor alerts. That's also something you can do with the pump. And then you can enter in a duration of silence so that you can keep those alerts off for a certain period of time. And then you can, of course, control the sound options by setting the pump to beep, to vibrate, or both. Up to you. Okay, next slide, please. I think these are the last 3. Thank you. So how do those on older model insulin pumps order the MiniMed 780G system? So the ordering process is very similar regardless of which model of pump you currently have. So those with older model pumps can still place their pre-order on diabetes.shop. The only difference is that you're actually going to receive physical new pump, right? Hardware versus that software upgrade, which is available with the MiniMed 770G system. And then what smart devices are compatible with the MiniMed 770 or 780G system? So you can check if your smartphone or your Apple Watch are compatible. You can do that by visiting our compatibility tool. I'm actually going to pop that into the chat so that you can get that. And I hope I make my friend Nathan proud. I just popped it into the Q&A. I hope you can see it. If not, I will make sure that you can. But the link is right there. You also have it on the slide presented right in front of you. So you can actually go on to that link to verify compatibility for your smartphone or Apple Watch. And you can also just go to our website and search it right there or Google it. And then the last question is, do I need a new prescription? Yes, a new prescription is required for the MiniMed 780G software upgrade, as well as that Guardian 4 sensor and transmitter. And that is it for our top 12. We're going to go ahead and get to the questions that you've sent in. Remember that you can ask questions in the Q&A feature right next to the video player. So go ahead and keep dropping those in. All right, so I'm going to go over to that section so that we can see what questions we have over here. Okay. Hey, Kristen Scavuzzo, I'm going to come to you with a question about when someone's going to get an upgrade. So I placed my order on May 15th. When will I get an upgrade? You know what? Maybe I'm going to try this one myself. June, the month of June. Am I right?
Yeah, so June is when we will start with those orders. And so on the back end, we're working with the providers to get the new prescription. And so this month we will start working through those. But as you guys can imagine, there's a lot. There's a demand here. So June will be when we start.
Thank you for that. I was hoping I got that right. All right, next question is, can the Guardian 4 sensor be inserted into the abdomen? So the Guardian 4 sensor has not been tested in the abdomen. So no, the Guardian 4 sensor is only labeled for use in the upper arm area. Okay, I want to come to, let's see, Corey. We have a question about how 780G addresses, if it does, dawn phenomenon. Have you had any experience around that in the last week that you can maybe speak to? Oh, you're muted.
If I did, I probably didn't notice it, because now whenever my sensor starts rising, the auto basal will kick in knowing that the target's at 100. And if I do reach that maximum, I'll get those auto corrections without it notifying me. But I'll say every morning I've woken up well within range, and I've had a very smooth experience when I go to bolus for breakfast and haven't had to do anything except for give some insulin at that mealtime.
Awesome to hear.
And I'll jump in. So that is absolutely what we've seen. And this is where the target of 100, as well as putting the active insulin time at 2 hours, is really helpful. So you have the best opportunity, the strongest auto corrections. And so for people that struggle with dawn phenomenon, this is, it absolutely kicks in, because every 5 minutes it's looking at that. And like Corey said, you just sleep through that and then wake up in the morning very close to your target.
Beautiful. Thank you for that, Dr. McBean. I'm actually going to stick with you if you don't mind. So we have a question about what happens if carbs are overestimated. Maybe you can give us a little bit of kind of background on what happens.
That is a really great question. And it isn't something we addressed yet tonight, but there is a new feature in the 780G where it's called the Safe Meal Bolus feature. What happens when patients enter in their carbs, the system does a calculation, and it actually does a prediction where it looks into the future. And if it predicts a low glucose, it will actually subtract from that bolus. And the user will see this on the screen of their pump. Now, of course, if they're significantly overestimated, there certainly may be an increased risk for a low glucose. But this is a great new feature of the 780 where it really helps when carbs are overestimated.
Thanks for that. I'm not leaving you alone. Stick with me. I've got another one.
All right.
This one's specific to exercise. So what are the recommendations for a patient when they're doing very active exercise? Is there a target, perhaps?
Great question. Exercise is one of my favorites. We do have a temporary target with the MiniMed 780G, and the target is 150 milligrams per deciliter. It can be set for anywhere between 30 minutes and 24 hours. The other thing that's important to note is that one of the common times people use the temporary target is with exercise. And auto corrections do not occur when the temporary target is enabled. So you're exercising, you want that glucose to be a little bit higher, and so you're not getting auto corrections. One of the things that I'll mention about temporary target for exercise specifically is we like it, the results are the best if that temporary target is turned on an hour or two before the exercise begins, because that gives the glucose a chance to kind of float up towards that 150 before the exercise starts. The other thing that I want to mention, because really teaching people about exercise is one of my passions, one of the most important things to be mindful of before exercise with any regimen for type 1 diabetes is to not have a lot of active insulin on board before exercising. So I always recommend to my patients that, it's at least 2 hours since they've had kind of a big bolus. And then one other thing that I think is also important to discuss just briefly is to make sure that you're not necessarily treating with uncovered carbs. Because if you're someone who has been, let's say you've been on multiple daily injections, we would recommend before exercise uncovered carbs. But with the 780G, if you eat uncovered carbs before exercise, what happens? Well, the glucose goes up and the auto corrections, or the auto basal and auto corrections may kick in. So the management for that is a little bit different, but yes, the target of 150 is extremely helpful for exercise.
Thank you so much, Dr. McBean. Excuse me. The next question I'm going to try to tackle, but if anyone wants to, help out a friend, by all means, feel free to come off mute. So what is the difference in cost between the Guardian 3 and the Guardian 4 sensors? My G3 sensors are covered by insurance. Will the G4 sensors be covered? So there is no difference in cost between the sensors. And we expect there to be no issues with you actually getting your G4 sensors as you have been getting your G3s. So no issues there. We should see smooth sailing moving forward. All right, I guess I did a good job with that. So why only arm insertion with the sensor? I'm assuming this question means. What happens if we use it in the thigh? So this would be considered off-label use, which we cannot speak to because it hasn't been studied and ultimately wouldn't be safe. So we always want to suggest that you have these kind of discussions with your healthcare provider so that you can work together to make the decision that is best for you. But as far as where the sensor is approved for use, because it's been studied and proven to be safe, that's going to be G4S on the upper arm. Anybody else have anything to add there? Okay. All right. So the next question. I'm going to come to Dr. McBean for this one. And Heather, maybe you want to add a little bit here as well. So how are the auto corrections on MiniMed 780G different than those on the MiniMed 770G in SmartGuard?
So that is a really great question. With the MiniMed 770G system, we had auto basal. And so every 5 minutes, the system was giving auto basal to reach a target of 120. Now, with the MiniMed 780G system, we still have auto basal. The difference is that we have choices of targets as low as 100. So now the auto basal is given every 5 minutes still, but it can target 100, 110 in addition to 120. The auto corrections are on top of the auto basal if needed. So every 5 minutes, 288 times a day, the system is making a decision. And so it's first it uses the basal, and then as the basal increases, if the max basal's reached and the glucose is over 120, then the auto corrections will kick in.
Thank you. Thanks so much.
I don't know that I would add any more. I mean, Dr. McBean, you're exactly right. The only way I explain it to people is, with MiniMed 770G, your auto basal was working as hard as it could to keep that glucose level right at 120. And with MiniMed 780G, it works as hard as it can. If you've got that target set to 100, to keep your glucose level as close to 100, target as possible. And then it's so amazing for those of you that are hearing this for the first time. It's so cool to see, like, your sensor glucose is going up, going up, going up. It's 100, 110, 118. And then as soon as it kind of crosses over 120, which is such a different, way of thinking about high glucose for us, if that auto basal, like Dr. McBean said, is working at its hardest and it can't, it needs some help, well, then there come the auto corrections right on top of the auto basal. So, the whole idea, the mindset that we used to have, like we correct high glucose with a bolus, that mindset has really just changed with this system, right? You don't wait till you're high and do something. You do something early and you do it often. So you don't go as high and you don't stay as high as long, for sure.
Thank you both. Kristen, I'm coming to you about a software upgrade question, specifically a warranty question. Will the update change restart my warranty expiration date? We know that?
Yes. Okay. No. So it will not restart the warranty date. So you will keep the warranty date of your 770 pump.
Perfect. Thank you for that. Corey Eck, we happen to have a question about putting the sensor on the arm. And no one knows this yet, but Corey is the star of one of our sensor insertion videos that you all will be seeing via the My Insights communications that you receive after you start on the MiniMed 780G system. So I can think of no one better to speak to the insertion on the arm than Corey. Corey, can you tell us a little bit about how you do it? It seems a little difficult to do. Any tips?
Yeah, and the best part about those videos is that I was able to get help from a friend, Paula, and that might be what we need to do in some cases, is get a help from somebody else. But for me, wearing the sensor on the arm and inserting here, it hasn't changed much from what it was with 770. The nice thing is I don't have to relearn a new way of inserting. But in some of those cases, if we need to ask someone else for a little bit of help, the nice thing is it's just once a week. And, and especially when I think about using extended wear infusion set now too, I just have a day that I change both my infusion sets and sensors. So as far as inserting it, I use the tape that comes with the sensor with a little bit of skin tack, and I go well. It works well for me all week. And like I said, I just changed it after 7 days. And it's worked well for me. But like I said, if you need to get some help from a friend, there'll be plenty of videos and support resources, as well as our teams in the field to help patients with that transition as they start on MiniMed 780G.
Beautifully said. Love it. Thanks, Corey. Hey, Dr. McBean, one last question. Can you speak a little bit about, since you, of course, are so familiar with all of the data, about low glucose values when using MiniMed 780G system and SmartGuard? What are we seeing? Is there a decrease in those? Is there any change in those? We have a question around just kind of hypoglycemia on the MiniMed 780G system and SmartGuard.
Great question. So the international recommendations for low glucose are to have the time below range less than 4%. And we have seen that consistently throughout our pivotal trial and throughout all of our real world data, that time below range is under 4%. Now, there's some real world data that I wanted to share with you that I didn't show you, where they took a look at patients before they started 780G and what was their time in range. Well, they had started on 780G, but they were in manual mode. And then they looked at what was their time in range before, and then what was their time in range after. And the group that I want to, and they split it up to like lowest time in range to highest time in range, and how did all those patients do? And to answer the question about lows, I wanted to talk to you about the group who started with the highest time in range. They were at 82% time in range, which is already amazing to begin with. But their time below range was actually at 3.4, which is still under the guideline. Now, when they went to the 780G, their time in range actually went up to 84%, and their time below range dropped to 2.5%. So we have seen consistently across all of the studies and our pivotal trial, time below range less than 4%.
Awesome. Thank you so much. I knew you were the right person to ask. All right. So we are all set. I think we got through the majority, if not all of the questions. Do not worry, though. If we have not, we will get answers to your questions out to you. Do not worry. All right. So as always, we want to hear from you, of course. So please scan the QR code, take a quick survey. Let us know your thoughts about today's live stream. We're always eager to learn more. We always want to improve your experience however we can. So please take a couple of seconds, scan that QR code. And while you're doing that, I just want to thank you on behalf of Medtronic, on behalf of the panel and I want to thank you all again for joining us today for this program. The time commitment is not lost on us. It's a jam-packed hour, so we appreciate you coming on board to learn more about the MiniMed 780G system. We appreciate it, and we hope that you're as excited as we are about this incredible new technology. So until next time, take care, everyone. Bye-bye.